It's wonderful to see so many of you registering for the webinar. We have about 400 colleagues who have expressed an interest and registered for the webinar today, and we are live streaming on many platforms. So give us a minute just to make sure we're not missing out people. And once we start hitting a decent number, we'll give a start. Brilliant. So on a rather dull, gray, cloudy day, the one bright spot that makes me feel the rush, even on this late hour, is a conversation with leaders in the field of primary care. These are leaders making a difference to the health and care you and I experience jointly. These are leaders making a difference to the health and care our future generations will experience. And we've had the pleasure of many such leaders gracing the conversations on this webinar series, The Future of Primary Care. Good evening, colleagues, and welcome to another one of our webinars. I'm Mohit Venkatram, and I'm the Executive Director of Primary Care at East London Foundation Trust. When East London Foundation Trust stepped into the field of primary care, we were very fortunate to be embraced by the amazing GP leaders who we had the joy of working with. Our motivation was very simple. If we could combine the large, enormous corporate power that East London Foundation Trust brought to the clinical leadership, the amazing GPs and their clinical staff provide on the ground, there was the opportunity for us to create absolute magic. And that was the motivation that brings me here today. This webinar series is one such opportunity for us to have a safe place to have a conversation around primary care, to recognize that together, if we could create these spaces, we could evolve together, we could learn together, and share those best practice examples that then create the magic I was speaking about. Today, there are over 400 of us registered on various platforms listening to this webinar. Think of the collective power we have to change tomorrow's healthcare for this whole country. And that is the difference we make together. While today, we spend time contemplating how to make a difference in the future, learning from each other, let's just take a moment to reflect on what primary care has already achieved on the latest published data for December. In December alone, almost 26 million appointments were delivered by primary care in this country. That doesn't include north of almost 750,000 appointments delivered by our PCN staff, who are the networks the GP practices work in. So often, many of us have grumbled, including me, I'll admit, that we just don't get GP appointments. The data actually shows 47% of appointments that took place in primary care, very nearly half, were on the same day. And 46% of these were delivered by GPs themselves. The other fact that many of us talk about is, do we actually easily get face-to-face appointments? Because that has been a bugbear for many of us. Actually, 67% of appointments in December alone, which is more than two-thirds of appointments, were face-to-face appointments of the 26 million appointments that were delivered. One then wonders, how does a service that delivers so much, how does a service that's under such enormous pressure find the time to modernize? Well, leaders like our speaker today, Dr. Gillian Orrow, have been making that possible. Our guest speaker is a graduate from King's. She has gone on to be a clinical fellow at Cambridge and is one of the crucial thought leaders in primary care. Dr. Orrow created learning sessions with the Surrey GPs, and together they coined the amazing initiative, Growing Healthy Together, a program that is being evaluated to show the enormous difference it has made to the local residents. I'm incredibly thrilled and so pleased to have Dr. Orrow with us today to share with us the learning, to share with us what worked and what didn't work, so that together as a community, we don't have to reinvent the wheel. But just before I hand over to Dr. Orrow, a reminder, colleagues, we are being live streamed on multiple platforms. There are about 400 of us who are logged on. So it is going to be impossible for me to ask every question you want me to do so. Please use the Q&A button on the Zoom platform to post your questions. I will select themes from those questions and ask Dr. Orrow to respond to those. Many colleagues have already posted the questions when they registered, which was an option available. Please don't worry, I will pick those questions up too. So, without further ado, let me hand over to the amazing Dr. Orrow. Gillian, thank you so much for joining us today. Let me hand over to you to share your thoughts.
Oh, thank you so much for that very kind and generous introduction. It's such a pleasure and privilege to be here with you this evening and with our incredible audience, whose work I am in awe of, as well, as you mentioned at the start there in your introduction. So I'm just going to share my screen. Please bear with me for just a moment. Lovely. Can you see that okay?
We can.
Marvellous. So as we've heard, I am a GP in East Surrey, and I've got the great privilege of having roles involving prevention and health creation and working with communities at a neighbourhood level, place and system level in NHS Surrey Heartlands. And it's a real privilege to be here tonight to tell you really the story of our journey. And I just wanted to say before I start, I wanted to emphasize that this is a story of a very specific journey and a very specific context that has been enabled by the most incredible people that I have the pleasure of working with, who've brought their skills and passions, and together we've created something completely adapted to our local context. Now, what this is not is a prescription to say that what worked for us in East Surrey could be taken and dropped into a different place. You will have your own context and your own thoughts and ideas about what's needed in your area. And I have no doubt many of you are already implementing very similar approaches, and I would have a lot to learn from you. But without further ado, I will get into the story. So my story began at medical school in London. I was at Guy's, King's and St Thomas's, as it was called then, now King's. And there I learned that health and healthcare should look like this. Seem familiar? I think that's what many of us would think of when we think of healthcare. And it was then many years later that I really started to learn about the incredible research that Sir Michael Marmot and many others are doing on the wider determinants of health. And it was quite shocking to me, really, how much the biggest influences on the health outcomes of our patients and their variation in a population actually comes from what happens outside of the four walls of healthcare institutions. And whilst I had learned a little bit about healthy behaviours and motivational interviewing and so on, perhaps what I hadn't been considering quite so much and hadn't been taught to in my undergraduate and postgraduate education was the influence of socioeconomic factors like employment, income, community cohesion, safety, education, the built and natural environment, and how they influence health behaviours and therefore influence health outcomes both directly and indirectly. And as a GP thinking about this, it's very easy to draw the conclusion, well, my part is this 10%, the quality of care, or perhaps even the 20% access to care as well. I can't do anything about that 80%. That's set nationally, perhaps internationally by governments and industry. But I started to think a few years ago, but could we do something about these things? Could we just like tiny bit of tweaking at a local level to try and make some of these things better? And I was inspired to start asking that question by my patients in the surgery, because again and again, and I think I'd been a GP in the village of Smallfield, and for about 5 years by the time I started thinking about this. And over those years, I'd heard consistent stories from my patients about how they were lonely and that was making them depressed, how they couldn't really afford fresh food and they didn't know how to cook for their children and their children were therefore obese or overweight, that they desperately wanted to treat their hypertension with lifestyle only and didn't want drugs, but they couldn't become more active because there were no cycle paths and they couldn't walk anywhere in the local area. And after years of hearing the same stories from different people and different generations of families, one day I had a chat with the fantastic senior partner of our practice, Dr. Michael Bosch, in the coffee room and just started asking him, are you hearing the same thing that I'm hearing? Of course, he was. And unbelievably, and I'm so grateful that he did this. He didn't laugh at me and kind of reject my idealistic ideas that perhaps we could leave the surgery and see if we could change any of these things. He actually, on the contrary, supported me in trying to do so and made the fantastic introduction to Catherine Saunders, who's on the right-hand side of this picture that I'm showing you here, who was the chief executive, newly appointed chief executive of our GP Federation, Alliance for Better Care. And she enabled me to, first of all, set up an action learning set. And we invited GPs and other health professionals from Surrey to come together and start exploring these ideas, thinking about the health and well-being of our patients and the wider determinants that influence that, but also reflecting on our own health and well-being and having our educational sessions in very beautiful settings, often with food, sometimes in nature, going for walks, sometimes with music involved. It was a very, very lovely action learning set that we were able to run. And we learned so much from one another through that. And then later that year, Catherine, as not only a chief exec, but also school governor, introduced us to all the local head teachers. And we had a meeting with them in our area, Michael, Catherine and I, and a colleague, Caroline, mustn't forget. And it was fascinating how that day we heard that the same root causes that were driving patients in hordes into our surgeries were also causing educational underattainment. But the root causes were the same. People were disconnected from one another, disconnected from food, disconnected from nature, and we knew we wanted to do something about it. We then held a community meeting. We invited our patients, community members, faith leaders, social prescribers, colleagues from the local authorities. And that night, there was a huge amount of excitement in the air because we'd recognise what the issues were, but we also, through coming together, could see huge opportunities for us to do things differently. And we then started taking tentative steps to make these things into reality. So, but from that night, we really had this collective vision that we wanted to collaborate with lots of partners outside the surgery, to co-create conditions in which everyone's health and well-being could flourish. And we were all aligned from the outset that we wanted to work in ways that improved health equity. So we wanted to improve the health of the entire population, but proportionately invest more to support those communities whose health needs had been not met as best as they should in the past. And the other unifying objective from the outset was the sustainability agenda in terms of environmental sustainability, recognizing that human health and planetary health are one and the same. Also recognizing that there's a huge need, really don't need to mention it, it's so obvious at the moment, to improve sustainability of our health and care system. And by getting to upstream prevention and health creation, we felt that there was a possibility of creating more sustainability. So we'd started to achieve some green shoots in Hawley Primary Care Network. And at this point, I'd like to acknowledge the fantastic support from our clinical director, Dr. Tom Ruston, and the rest of his PCN board, including Michael Bosch, who I've already mentioned, who got behind this project from the beginning. And when PCNs were formed, they gave a small amount of seed funding to get this work underway. And then when the COVID pandemic hit, whilst it actually delayed and got in the way and interfered with so many of the practical projects we were trying to implement in Hawley, at the same time, health inequalities and different ways of working with communities suddenly became very high on the national agenda. And therefore, our work came to the attention of our commissioners in NHS Surrey Heartlands. They loved what we were doing in Hawley, and they not only wanted to support the work there, but they wanted us to help our neighbouring primary care networks, of which there were 4 others, to adopt similar approaches. And thanks to the support of the clinical directors and their boards of all of our other PCNs, we were actually able to appoint a Growing Health Together lead, GP lead, for each of our 5 PCNs in East Surrey, each of them having 1 session of protected time each week to spend outside of the consulting room, creating health with communities. And sometimes when I say that, people get concerned that should a GP be outside of the surgery when it's difficult to get an appointment? So I'd like to put this figure into some context. We have 122.5 full-time equivalent GPs in East Surrey. And the total time all of these faces on the screen have with communities is less than 1 full-time equivalent. So it's actually significantly less than 1% of all GP time in East Surrey. We've got a population of 185,000, and the average cost of running this programme has been less than £1 per head of population over this time. So it's a very small investment, and yet, as you'll hopefully hear in a moment, we believe it's starting to generate real returns. Now, rather than asking each Growing Health Together lead in their area to perhaps analyse data and deliver projects, which may sometimes be indicated, we were actually early on approached by an incredible health visitor called Hazel Stuteley, who pioneered the health creation movement, I think over 2 decades ago, on a housing estate in Cornwall. And through developing an approach which has been studied and analysed by the University of Exeter, they've been able to demonstrate that this can help to reduce health inequalities in ways that are sustained over decades. So we were very interested in this model, and Hazel emphasised that what we needed to do was not deliver anything, it was first of all to connect with our communities, particularly those who'd been underserved in the past, and to build relationships and trust. Then to be listening to our communities and others in our local area about what was already strong and supporting health and well-being in our PCN area, so that we could highlight and connect more of our patients to benefit from it. But then we also wanted to listen to our communities about what the challenges are in our area and what might be the barriers to them experiencing improved health and well-being. And this is probably the hardest part for us as doctors, is rather than jumping in to try and fix what we've heard as the problem, Hazel stressed that what we must do is try to enable the community themselves to design and implement the response to whatever they knew the issue was, because of course people who are experiencing any particular issue are so close to the problem that they're much closer to the solution than somebody who's many steps removed. But as we've heard at the beginning of the story I told, sometimes the issues patients identified were actually beyond the reach of what any community member could do. Putting in a cycle path would be a good example of that. So we knew that there would be instances where we needed to collaborate with not only local citizens, but also bring in lots of other partners who could make the changes happen that our communities were asking for. And now I'm going to just run through a very small number of examples of what this looks like in action. So we're going to start in the village of Smallfield. So after the pandemic, as we were just emerging from lockdowns, my older patients were telling me how deconditioned they'd felt through staying in their homes during the pandemic lockdowns. We had a fantastic walking group, which was led by patient volunteer champions from our surgery. But lots of the older patients said, I'm not well enough to go for even a short walk. I'm not fit enough. And it became apparent that there was a need for a village-based inclusive exercise class, because so many patients said that they couldn't actually get to the neighbouring town for something similar in the leisure centre there. So we started talking to local community members. How could we address this? What could we do? And the vicar's wife offered us the village hall, which is just opposite the surgery. The vicar's wife also knew this wonderful exercise instructor who was also local. She made us this lovely flyer, and chair aerobics was born. And 2 years later, it's emerged into more than just a chair-based exercise group as patients have become stronger and fitter. Over 35 patients are attending each week, I understand. And there have been fantastic reports, including from a woman who reported how she'd been hemiplegic for 3 years. Through attending this class, she can now move both limbs. She can now be independent at home. Another patient who was agoraphobic hadn't left their home for years. Their neighbour convinced them to come. They've now made many friends. They've never looked back. And there are so many other lovely stories of how this little intervention, and new people are coming in all the time, has really transformed lives. And of course, for those who are interested in the economic case behind this, there's plenty of evidence that that physical activity is one of the best buys in prevention. So it's going to be doing so much for saving and reducing demand on the health and care system too. Now moving to a different part of East Surrey, to Red Hill, the population health management data in that area showed poorer health outcomes in our South Asian community, particularly reflected in higher rates of hypertension, diabetes, ischemic heart disease. And our excellent Growing Health Together lead in Red Hill, Dr. Uzma Aziz, was extremely passionate in taking this forward and creating better outcomes. So she has been working with a community leader, or a few community leaders from the South Asian community, and a community development worker from the local council. And together, the community leader has set up the South Asian Women's Wellness Hub, involving physical activity, talks on diet, mental health, and so much more. And there have been all sorts of beautiful spin-offs, including the group deciding they needed a women's only swimming group, which needed to be in a private pool, not a public pool. And they managed to sort that out. And I think we got them a bit of funding for it. They couldn't cycle, and we were able with the county council to bring in refurbished bikes, which they could use for free, and people to train them. And then their daughters became jealous of this growing Asian Women's Wellness Hub, and they started their own sister circle. And I believe there are somewhere between 50 and 100 members too. So this is for younger women, and they are appreciating coming together to talk about issues which might otherwise be taboo culturally, including around LGBTQ+, health, sexual health, domestic violence, and much more. And as in the exercise example, we're hearing very positive qualitative feedback on this, and we hope that we'll have quantitative data to follow on the impact of this. Now moving to the North Tandridge area, where we have a wonderful GP, Dr. Richard Wright, working as Growing Health Together lead, who until very recently was also the clinical director of the Primary Care Network in North Tandridge. One group of the population he was hearing a lot from was young people who said our mental health is suffering simply because there's nowhere for us to go and be with our friends where we can be safe and have fun, particularly at the weekends. And then through bringing together young people and their parents with the schools and the local leisure centre and partners from the district council, the Friday Night Project was born. And in the first week of this, I think over 120 people were queuing to get in to this programme of sporting events, dance, boxing, and more. And it's continued to be incredibly popular. I can't remember if it went to the third year now or just the second year, but it's been so popular, and children from neighbouring areas have been wanting to come to this, that we've set up another in the South Tandridge area, and just this week we're launching one in Hawley and one in Reigate to follow in the next month. And now moving to the South Tandridge area, our fantastic colleague, Dr. Anna Mustel, is doing a huge amount of work in this area. And one group she has been working with is a charity called Warren Clark Golfing Dreams. So this is led by an amazing family who are autistic and have learning disabilities. And they have a passion for ensuring that people who are experiencing similar challenges can be physically active, have fun, make friends, and connect with nature. And they've launched this inclusive golf club, which also offers other sports. They've now been affiliated to Special Olympics Great Britain, and their plans underfoot to offer outreach health checks to those who are taking advantage of their fantastic facility. And then in a similar area, it's been an absolute privilege for us to work with some incredible community leaders who started the group Africa Community in Surrey and Sussex. And they hold fantastic cultural events with music, drumming, book clubs, and more. But then they also weave in responding to the health and well-being needs of the members of this group. So we've given talks on the wider determinants of health and different health topics of interest, including prostate cancer, sickle cell disease, and the group are now working with partners from the hospital to improve sickle cell care. And one of the younger members is now setting up a youth club in the area to enhance provision around poetry and arts. So it's a very emerging piece and really exciting and a great privilege to watch unfold. And then last but not least, our wonderful colleague, Dr. Tabassum Siddiqui, is our Growing Health Together lead in the Merstham area. And she works also with Dr. Ivan Anderson in this in the Care Collaborative Primary Care Network. And they're both doing lots of fantastic projects in their area. And the one that I'm just going to highlight here is a program improving care in the first 1,000 days of life, which we know is well evidenced to improve health inequalities. And that's the end of my kind of talking more intensively about the case studies, but I just wanted to emphasize that what I've shared with you then is really the tip of the iceberg. There are so many other projects, and some of them, a selection of them are on our website, so there's lots more there, but even the website itself doesn't capture them all because the number of projects is so big and growing all of the time. But you can see on this picture, we've got trim trails, community gardens, cold water swimming, a care farm for people with autism and learning disabilities is just starting now, art projects, and so much more. And these have been made possible through so many different incredible community members, organizations, businesses, farmers, landowners, philanthropists, coming together and sharing their gifts for the benefit of the wider community. And through having that protected one session per week to connect with all of these amazing partners, we can connect the gifts that are being offered with our patients and our staff. Now, the relationships and the trust that we've built up through our Growing Health Together work over the past 3 years has been really helpful in informing the neighbourhood model in East Surrey, which of course has come on following publication of the Fuller Stocktake report, which I'm sure many of you on this call will be familiar with. I'm going to stop talking in a moment, so I won't say very much on this, but just to say that we've established health and wellbeing networks in each of our 5 neighbourhoods. And these are allowing us on a rolling basis to meet with all of those different partners to get their views, and patients and community members to get their views not only on what we should be doing outside of healthcare, but also how we can improve what we do within healthcare. And this is just an example of what was discussed at one of our meetings last year. Patients wanted us to improve the education of staff around the support available for carers. And we're also building a new mixed-use health creation space, but with clinical space on a new housing estate, which just simply never would have been possible without the people who live in our area and those of us who work in that area coming together to create new possibilities. Our work is being evaluated, and we hope to have some outputs from that later this year. And I think I'll just end here by saying that we are seeing the impacts of this work on the health and well-being, not only of our patients and communities, but we're also seeing the benefits in our staff. And we're seeing how people quite enjoy this work. They find it enlivening and rejuvenating. And there's also been positive impacts on the health of our natural environment locally too, which I'm very pleased about. I think what I've been most surprised by, because I was starting this not as any big project or with any big ambitions, really, it was to do something very practical around my surgery, but seeing how people's attitudes around what health is and where we should be investing to improve health and well-being of our population really seems to be changing. And I'm very encouraged by that. And I'd just like to say a huge thanks to all of the amazing people who've made it possible, particularly our GP Federation Alliance for Better Care, who host us, and our funders, NHS Surrey Heartlands and Surrey County Council. Thank you.
Gillian, wow, just wow. This was so exciting. Many of those live pictures made me want to jump into them and be part of those amazing groups, from the chair-based exercises all the way to the African drums. They're just so motivating, and it's such a nice way of integrating healthcare into everyday life. As you can imagine, the Q&A is absolutely abuzz with questions, but since I am the moderator, I have the privilege of asking the question that makes me want to go for this. What you're talking about is some phenomenal initiatives that actually make a real difference to the lives of the residents. Because actually the Marmot report talks eloquently about the fact health is not just health alone. It's housing and education and how people are brought up in early years of life. All that influences health. The question to you, I trained as a doctor 33 years ago. You would have trained a fairly similar period now. Medical education has not changed, and our expectation from clinicians, from doctors, from nurses, from therapists, from pharmacists is different. Patients want differently. I mean, I have 2 long-term conditions, and I think if someone told me they were looking at my expectation, the life expectancy, I really couldn't give a damn. My interest is, how do I make sure I am a happy father, I'm a happy son, I enjoy my life, because actually that's what we all want to achieve. Do you have any thoughts on what should be done around medical education and the clinical education in general? So as clinicians, people who are trained today aren't trained in exactly the same way I was treated 33 years ago, because those pictures you put up are actually true even today for doctors who come out from the system.
Oh, that's really interesting reflections. And I agree with everything you said about my own personal wishes when interacting with healthcare. And I think all of my colleagues say the same thing. And yet we practice in a way which is so divorced from our lived experience. It's quite remarkable. And I think it is really that integration of our personal health and well-being and our insights from that, and that of which we learn about from our family's health and well-being, and then applying that in practice, which has made this initiative different. And in going to your question around medical education, I think it's absolutely key And it was interesting for me to hear in a conversation with Lord Nigel Crisp, who some people on the call may know wrote a fantastic book called Health is Made at Home, Hospitals Are for Repairs, which I highly recommend anyone reading if you haven't already. So Nigel used to be the chief executive of the NHS in England and Wales, but is a big proponent of health creation. And I spoke to him last month, and he told me about a campaign which is actually starting with medical students in medical schools in the UK right now, and they're starting a campaign to shift medical education in exactly the ways that are aligned with the work that I just described. I believe this is going to be launched as a campaign in April, so I'm afraid I can't give you any spoilers, but there's something on the way, and I think I'll certainly put my weight behind that, and I'm sure many others will too. And then on a more sort of local practical level, through the research that's being done on our work by the University of Kent, it's also supported by Brighton and Sussex Medical School, and they're interested in us applying the learning lessons there. So
Wow.
that's a start.
That is brilliant. That's absolutely brilliant because that changes the future of healthcare in a way that
That's right.
that initiatives by themselves don't. And I think there are so many questions on the funding, as you would imagine. It's who's funding this? Local authorities should fund it. Is it their job? Is it the health? And if you're making a saving, is the PCN funding it? And where is the saving going?
Yeah.
Thoughts on this?
Yeah, great questions. So it's a mixed contribution of funding. So our primary care networks have been supporting this through development funding. And then that's match funded by NHS Surrey Heartlands from Better Care funding. So that's how this is funded at the moment. And it's all been in-year funding. So from one year to the next, we haven't known if we'd have a programme, but I'm very pleased to say that we've recently established that we will have a programme moving into the next year. So that's great.
I think if I may throw in my penny's worth in this, great ideas often die because people get caught in the logistics of funding. And perhaps with 400 of us here, I am absolutely convinced there must be 400 fabulous ideas everyone who's passionate, who's joined today will have. Let's not get caught in the logistics of will the funding work? What will be the long term? Let's just start the idea. If it's a really small idea we can afford, let's run it at a really small scale. Because the change we make is what will buy in and get more people involved in this. And each time we make that difference to the life of one resident, it's one person who's better off than they were yesterday. So I absolutely love what Gillian spoke about. It started with this really small initiative. It was a kernel of an idea. It was pushed through not based on funding, but based on emotions and heart and people's wanting to do the right thing. Today, the fact that it is spread to the whole of Surrey is an absolute testament to the enormous work done from that one single idea, which everyone now believes in. And I think, Gillian, the question then that comes back, which some people have posted in different ways, is really what we are trying to achieve and what you have very, very successfully achieved is a cultural change in the way people see things. It's not just about the training. It's not about the funding. It's how do you culturally support colleagues who have been trained in a particular way, have practiced in a particular way. I mean, my background is A&E, and even today, I gravitate towards certain size of eustachian tube when I intubate because that is what I'm used to. How did you manage to achieve that cultural change? Because what you are achieving today and talking about is not the role of the one session funded GP. It is every GP, every clinician, the health visitor who came in believing in this vision that we can make a difference, not based on the drugs we prescribe, but on changing the lifestyle of colleagues so that they were stronger and our residents actually were empowered. So how did you get that cultural change embedded?
That's a really great question. And just going back to your comments beforehand, I'm so glad that you said that because it was exactly our experience that we just sort of stepped out into the unknown, not knowing or we're necessarily even believing that we would be able to achieve what we wanted to do, but believing that we had to try. And all of the enablement and the funding and the structure and the cultural change happened as a consequence of our actions, not the other way around. And when I talk about this work, sometimes people say, oh, I can't do it because there's no funding, I can't do it. I think you're absolutely right that if you wait for the funding and the plan, it's probably never going to happen. In terms of the cultural change piece, I think I was just extremely lucky to be in the right surgery with the most incredible boss, Dr. Michael Bosch, and then to meet Catherine Saunders, because both of them were willing to think big and open their minds to a different way of thinking. And I'd come from academic training at Cambridge, as you'd mentioned, on prevention. So I felt very confident in the evidence base. Oh, and I'd done some work with NICE, writing public health advisory guidelines on prevention of frailty and dementia and disability. And so I knew the evidence was there and I could see it was just not happening. So I guess I had a sense of frustration, but also I had a sense of love for the community I was serving. And I just thought my patients were amazing. I thought my colleagues were amazing. And I wanted to try and do something to give back. Perhaps at this moment, it's also worth me mentioning that I was not in a position of power when I started this work. I was a GP retainer. I'd taken some time out as a mother. I'd been in the past a partner and an academic and in policy, and I'd done lots of different things. But at this stage of my career, I was a mum and a carer and a GP retainer doing just 2 clinical sessions with lots of other caring responsibilities around it. So I wasn't in a position to influence any change, but any change that perhaps resulted from it was all through conversations with colleagues. And I think perhaps that learning set where we showed up as our full selves and we were supported in a kind of well-being conducive space perhaps enabled others to open up in a way that might be harder in an auditorium, let's say.
How fabulous. How absolutely fabulous. And colleagues from Dorset who have spoken about the amazing work you're doing, don't stop what you're doing. It is just phenomenal. I know the question is, how will the NHS pick this up and make the changes and the commissioning framework? Will it pick up the shared outcomes? I promise you they will. There is nothing better than showing the success of an idea, to stick with it. Don't worry about the scale. If you're doing it small scale, it is just perfect because you can manage it. Look at the example of what Jill says. And I know the one thing I don't agree with Jill is when she says she started, she was not as powerful. I see you as a really powerful person, Jill. You have done some amazing things. And what you've created, Gillian, is something for all of us to learn from. So I don't know if you thought you were not powerful when you started out, you were probably an absolute, a coven of ideas that has made such a difference today. And it doesn't happen overnight. It happens with someone who really has the passion to make a difference. I think one of the really good questions that has come out is, it is great to have these good ideas, but how do you integrate that into the day-to-day practice of a GP's? Because you know how it is. You go back and you look at your EMIS template and you look at your System 1 templates and you really go right back into, is the diabetes check done? No. Have you made the referral? But what you forget is actually the diabetes check may be important, but what's more important is to get them linked to the walking group. So how have all these initiatives been linked into the social prescribing and wider prescribing process? Have you got templates on System 1 and EMIS that allow people to intuitively think, actually, these are the other initiatives available?
Mm-hmm. I think there's so much more we can do to improve in this space, but it's a work in progress. And thank you for your kind comments about my role in it. But honestly, it's a massive collaborative effort, and it's through the multiple relationships and the passion and love and interests and talents of so many people that's created what we've got. It's certainly not about any one individual. And I think that is how we've affected the change that we have in the consulting room of GPs who are not involved in this. So having that seed of a person in each primary care network who had a passion for this work. Most of the GP leads I mentioned were in the action learning set that I described. So they were really brought into this idea and had their own personal passions. So one of those in each primary care network, and then they spread that passion and enthusiasm through their practice. So it's happened informally. over time, we've done more work proactively around communications, around the different activities happening in each place. But really, we don't necessarily want practices to be a bottleneck for it. We actually want the information to be publicly available and accessible and very prominent to communities themselves, particularly those some don't access healthcare. Some of our patients, or historically, some of them haven't accessed healthcare. And I'm including some members of our minoritous ethnic communities here who said that since they've been part of these events, they now trust us and they will come to the GP, which is fabulous. But yes, it's a combination of trying to improve the visibility of this work within the healthcare system, but also ultimately to everybody in our population.
How fabulous. How fabulous. I think there's some amazing questions around how do you integrate the voluntary sector without just passing work over to them? So at East London Foundation Trust, we've been very fortunate over the last 3 years. I'm also the chief exec of KIC, where we have managed to fund about £14 million of resources to our local voluntary sector partners for the amazing work they do. Because like you're talking about social prescribing, actually it exists in absolutely every part of medicine: acute care, primary care, community services. So we have been able to integrate the power our voluntary and community partners bring in my role. That's one of the other things I have led there. How did you manage to get the local authorities signed up to this? Because I have never come across colleagues from local authorities or elected members who genuinely don't want to make a difference to their local population. They are so committed that sometimes you learn so much from their passion. But there is no doubt, resource-wise, while in the NHS we often talk about lack of resources, actually they are tighter still than us. They are in a really difficult spot. How did that change come about? Because many of the initiatives you've spoken about require some element of sign up and support from the local authority partners. How did that happen?
It's been a journey, I think it's fair to say. But we were really kickstarted on our journey by Surrey being one of the first ICSs. It was a pilot ICS, I believe. And Claire Fuller, author of the Fuller Stocktake, was the CEO of NHS Surrey Heartland. So there was amazing integration at the system level of the county council with the NHS in Surrey. And the health and wellbeing strategy was straddling those two organisations. And their priorities were around health equity, population health, and climate change, actually, from the county council side. So it almost aligned exactly with the Growing Health Together vision, which was entirely ground up from our conversations in the community. So that part was amazing. And then our borough council were already doing community development work in part of our patch. So they were already really interested in working with communities and doing amazing stuff, and had never been able to engage with NHS partners, they told me, never ever. And they met more in something like 3 months than they had in 30 years or something. After Growing Health Together was formed, they suddenly had this flood of health professionals wanting to work with them. And then our Tandridge District Council, whilst not having community development resource per se, they were just absolutely signed up to the vision and have been incredible facilitating partners with us too. And we now all sit on a communities prevention board in East Surrey Place, which just helps those join ups. And in regard to the voluntary sector, we have, through the Prevention and Communities Board, been able to provide funding. And also one of my roles is just advocating for the voluntary and community sector, supporting their applications for money and funding and whatever else it might be that they need.
How fabulous. I think one of the challenges I think many colleagues have listed out in the Q&A session is, how do you prove the concept that this investment is actually making a difference? Because the reality is we live in a world where the only unit currency people recognize is money. So what's the saving on the prevention? How is it making a difference? Are we reducing? And Gillian, you have so masterfully been able to link in the various relationships you had, including your NIHR partners, to be able to create an evaluation scenario, because it gives the ICB, which is keen to support these initiatives, the tools it needs to be able to invest in them.
Mm-hmm.
So the question, with many of the partners talking of phenomenal work they are also doing in different places, I can see their colleagues talking about growing stuff together, Dorset colleagues talking about similar things they are doing. where should they go so that they can get a supportive evaluation that gives some teeth to the local ICB to think about the opportunities this creates? Because the local academic health sciences are fairly stretched. Quite often they are. So what
Mhm.
would be your advice to such colleagues?
Mhm. It's such a good question because I found in the early days, essentially, we were asked to evaluate and prove the concept ourselves. But the trouble is, with such a small time available, if you're proving everything you're doing, you're probably not going to be doing very much because to be able to demonstrate it takes a lot of time. I really struggled to secure external funding for the evaluation, and eventually it came via a circuitous route. I think it was our GP tutor, Dr. Terry Lovis, put us in touch with the NIHR ARC for KSS, and they were looking to do some research on innovative primary care, and we were in the right place at the right time. But it took a couple of years, good couple of years, to secure that. Whilst actually I'd been trying to secure the evaluation partner prior to us really starting to do anything, because I'd wanted to get a baseline. So I can't report on the outcomes today, but it's good that that's in progress. So I think connecting with your local ARC in whichever deanery you work in would be a really good place to start.
Fabulous. Colleagues who've been asking this question, many of you in different formats, please make a note. It's a good place to start. Please do link in because I promise you, we are living in a different world today. I recall the time when I had just qualified, when health was only about prescribing medication, treating diseases. Colleagues in the ICB, local authority colleagues, are so keen for us to support initiatives on prevention. Log on, support them, and log on to the support Gillian has shared with you all. So try that. Otherwise, do get back in touch and let's see what other forums are available for us to get the best outcome for all of us. I think there are some amazing questions also on neurodiversity, learning disabilities, autism, and groups that can be put up. So colleagues want to connect around them. And I think, Gillian, you shared a couple of examples on the work that's happening. I've seen many such examples for neurodiversity, some around gardening, because they are amazing at gardening. And I've seen initiatives in trusts where actually social enterprises have emerged for people with neurodiversity running the
Amazing.
gardening group. And then they do the gardening for many of the statutory organizations. So we've got one in Hackney where a group of absolutely amazing gardeners have got together and proved what skills they have. And they are all neurodiverse and they do the most amazing job at keeping those gardens beautifully aligned. So help that grow. I think there are still some questions pouring in about the funding. We do need to recognize this is not just about the health funding because there are loads of people who want to commit to this and make a difference. Please do link in with wider initiatives, volunteers, people in the community, your patients, local residents. There are so many people who want to make a difference to everyone's lives, and this gives everyone an opportunity not only to do that, but connect together to make a difference. So we are coming to the part where we are 5 minutes before our close. And I'm really keen not to overrun that because many of you commit to this time, this late hour, because of the fabulousness many of our guest speakers bring to us. So my last question to you, Gillian, if you had a magic wand today and wanted one key change made that will help this initiative stay alive, what would your advice be to all the amazing people who have logged on today, the 400 people who want to make a difference?
Oh, such a good question. I wish I thought of that in advance. One change. Oh, I think for anybody listening to this who's really passionate and knows that there's something that needs to be changed in their local area, don't keep it to yourself. Speak to others about it and join forces and try something. It's really that simple. I
I,
think
I,
that'd be
I,
my advice.
you are so amazing, Gillian. I think your passion, your exuberance flows through when you talk about the subject, and it is so infectious that it has touched every one of us today on this webinar. When I first heard the concept, I was so taken in by the amazing feedback I had been hearing about the growing healthy together concept that you have led in Surrey. And today I understand how a really simple concept, executed beautifully, led with passion and experience, and real care, creates the bright future for all of us who are really wanting to find a difference healthcare for tomorrow. Because this is the kind of thing that makes a difference, not just to primary care. And often in these webinars, we have focused on primary care. Actually, this is a difference that makes to the whole of the NHS and how all of us will experience care going ahead. The thing that really struck a chord today with me was how you had very masterfully transferred the ownership of that healthcare back to us as residents. Because that ownership is where the strength of this model lies in, with support from clinicians, because it's we who know the life we want, and we who can push ourselves to that strength that's needed to create the brighter future for tomorrow. Gillian, you brought to life some amazing, amazing examples on simple principles that I think many of us can adopt and adapt across the systems we all work in. Thank you. Thank you so much for what you've done. Thank you so much for what your partners have worked with you on. And thank you for taking the time to share this with us today, because the words that really resonate with me is be idealistic. It's good to dream. Work with others collectively. And that is so crucial in making that change. But most importantly, connect the different agendas. I love the concept when you spoke about connecting the improving health agenda to the sustainability agenda, because they are all related. It is not different things we are talking about. We talk about social prescribing, we talk about anchor institution principles, we talk about sustainability, we talk about Marmot. Actually, they are part of the same principle that we are all working towards. So thank you. Thank you so much.
Thank you so much.
And may I also add an absolute fabulously big thank you to the 400 of you who have logged on, who have made this so vibrant and live. You know, the sessions only work when you are absolutely in control, and the power from the questions that you have posted today was absolutely amazing. So this session would never have been as lively and as much fun had it not been for all of you taking such an active participation in what we have experienced today from Gillian's amazing work in Surrey. Now, most importantly, I also have a big thank you to post, because no session would be possible without the two amazing colleagues who in the background make all this work beautifully. Sarah and Fahana, thank you. You just make these flow like a stream, and I couldn't have done it without you. So thank you for that. Next month, on the 20th of March at 7 p.m., we're going to bring a very different flavor to the future of primary care. We have invited a secondary care clinician, Dr. Lucy Abbott in Frimley Health, who has created an integrated model with primary care colleagues. It shows the power of primary care changing the world in secondary care. So please do log on for that. Sarah, as usual, has posted the amazing QR code, because these are your sessions. They are not sessions run by me. They are run for you. Please do post your comments on how the session went, what changes you would want, because we are able to use your feedback to make it better for you next time. It's been amazing having all of you. Gillian, thank you so much for your time today. And I wish everyone a fabulous good night.